Teman-teman pekerja migran Indonesia di Hong Kong yang saya banggakan, keselamatan dan kesehatan kerja adalah hal yang harus diutamakan dalam bekerja. Hal ini penting untuk memastikan bahwa teman-teman bekerja di lingkungan yang sehat dan dapat bekerja dengan aman, sehingga jauh dari risiko yang dapat membahayakan diri sendiri maupun orang lain. KJRI Hong Kong dan Occupational Safety and Health Council Hong Kong berkomitmen untuk terus membekali teman-teman melalui program-program yang informatif untuk mendukung penciptaan lingkungan kerja yang aman dan sehat. Mari bersama-sama kita membiasakan diri menerapkan prinsip keselamatan dan kesehatan kerja. Terima kasih.
Hello, I'm Enoch from OSHC. Today, I will share with you some key safety and health issues for domestic workers and the related precautionary measures. First of all, I would like to introduce ourselves, Occupational Safety and Health Council. We are a statutory body in Hong Kong established for promoting safety and health at work and sustaining the valuable workforce. We have different social media platforms such as website, Facebook, Instagram, and YouTube to promote OSH information to people from all backgrounds. Some of our promotional materials are available in different languages to ensure that you can easily access them. You can visit our social media platforms through the links or QR codes on the screen. Due to time constraints, I will only go through some of the high-risk work, such as window cleaning, using chemical, and using electrical appliance. Before going to the first topic, let me remind you that you should always be aware of your surroundings, be familiar with your tasks and workplace. The lack of knowledge due to different working environment, equipment, and substances may cause dangers to you. For example, if you have a new equipment, you may not know how to operate it. It may be dangerous. To protect yourself, you should actively obtain the safety guidelines, instruction, or user manuals from your employer, and please read them so that you know how to use them and know all the potential dangers and how to avoid them. Let's go to the first topic. As many Hong Kong homes are in high-rise buildings, falling from height is one of the main risks that you would face when cleaning windows. So please stay alert and apply the safety do's and don'ts when cleaning windows. Over the past few years, there have been a number of serious accidents related to domestic workers cleaning windows. In these accidents, the victims fall from a height, resulting in serious injury or death. You can see on the screen that 3 out of 4 cases happened in January or just before Chinese New Year. Please be careful when you do the spring cleaning. We hope that you will learn from these painful lessons and take appropriate measures to ensure that similar accident will not happen again. So please pay attention to the following points. First, you must ensure that window you clean is fitted with a grill, which is locked or secured in a manner that prevents the grill from being opened. The grill can protect you from falling through the windows. Second, you must stand on the ground while cleaning windows. You should not step on any objects, for example, chairs or other furniture. Otherwise, you will lose balance easily and get injury. Even if you stand on the ground, it is still dangerous when you stretch your body out of the window. Therefore, you must make sure that no part of your body extends beyond the window ledge, except your arms. In some cases, the window may be far away from you. It would be quite difficult to clean. You should not lean against the windows or window grills because they are not designed to support your weight. The best way to clean windows that are hard to reach is to use proper tools with a long handle. However, any dropping objects could pose dangers to people on the street. A tool lanyard should be used to prevent the tool from falling. Now, I will show you a video about cleaning windows.
咪住，冇裝窗花仲企高抹窗，企翻落地，用長柄工具抹就啱啦。同埋要盡量加裝窗花啊！咪住，點可以成個身污出去㗎？所有窗花先安全㗎。咪住，挨喺窗花借力點得㗎？淨係伸手出窗外面抹就穩陣咯。
Put safety first when cleaning windows.
Next, we talk about using chemicals. Various chemicals are often used for household duty, such as detergents, solvents, and bleach. These kinds of products can be dangerous and cause burns, fires, and poisonings if not handled safely. I will show you some of the common hazards and the safety measures related to household chemicals. You come into contact with household chemicals every day. The hazards may often be overlooked. Here are some related accident news in which all cases are caused by mixing different chemicals. The victim suffers from serious injury or even death. First, you should pay attention to the hazards and the safety measures before using any chemicals. Different chemicals have different properties. Please read the label on the container carefully. The label should show you on the left side a symbol indicating the hazard classification. Then on the right side, the label contains information about the name of the chemical, particular risk, and safety precautions. But you may say, we seldom see this label on household cleaning container. Then what should I do? In this case, you should read the instruction of use on the container. For example, a cleaning agent states that it is corrosive, avoid contact with skin and clothing, and never mix it with bleach or other cleaning products. You should read it before you use the chemicals and follow the instruction. I also read the information on the container of a bleach. Bleach is a strong and effective disinfectant. Improper use of bleach may reduce its effectiveness as it can also make harm to you. As shown on the container, you should put on appropriate personal protective equipment when using it, as it may irritate your eyes and skin. Bleach should be used in a well-ventilated area and do not use with hot water, as hot water decomposes the active ingredients of bleach and make it ineffective. Once again, like cleaning agents, it states that you should not use bleach together with other household detergents, as it may cause dangerous chemical reaction and harmful gas could be produced. This can be result in serious accidents. The last example I want to show you is an insecticide. It contains a symbol indicating that it is flammable. It means it will catch fire easily. So you should not spray it near heat source or any operating electrical appliance, as it may cause fire. What we have learned so far? First, you should always follow the instruction when using chemicals. And one of the most important rules is that you should not mix cleaning products with one another. Please remember. Besides, chemical may burn or irritate your skin or eyes. To protect yourself, you should avoid direct contact with them by wearing suitable personal protective equipment such as gloves and face masks, which depends on the work nature. To ensure the greatest possible protection for you, you should also wear goggles and apron when necessary. Most of the chemicals are poisonous if swallowed. You should not eat or drink when handling chemicals. On the other hand, you should not store chemicals into food or drink containers because it is easy for someone else to get confused about what's in the container. You should keep the cleaning products in their original packaging. Chemicals should be used in areas with adequate supply of fresh air and be well ventilated with a fan or an open window. Wash your hands and arms with soap for 20 seconds immediately after work. When storing chemicals, you should ensure they are stored in shade, cool, dry, and well-ventilated place and in a safe place where children cannot reach them. In case of emergency, such as chemical poisoning, fire, or contacting with chemicals of your body, please inform your employer and seek medical assistance if required. Now, please watch the following video about using chemicals.
Schöne, wenn sie Bamende, dieses erste.
Jadi jembat, berjeng jembat deh.
Please remember, don't mix chemicals. The last topic is about using electrical appliances. The potential hazards of using electrical appliances are often underestimated. Using electrical appliances unsafely may cause fire or electric shock. To protect you and your family, you must ensure that you use them and maintain them properly. Accidents related to electrical appliances occur in recent years, mainly involve the improper use of heater, ovens, and chargers. Nowadays, there are many kinds of electrical appliances in a family. If you are not familiar with the appliance, you should read the user manual for its use and maintenance. You should also know how to use the electrical appliance. For example, do not place combustible objects such as curtains or clothes near an operating heater. Ensure that there is sufficient space around an electrical appliance for heat dissipation. A common cause of electric fire is overloading. You should avoid plugging too many electrical appliances into the same socket circuit, such as adapter or extension unit. On the other hand, you should identify the electrical appliance with high power consumption. For example, iron, heater, or oven. Do not put them into a singular socket outlet and use them at the same time. Another cause of electric fire is related to charging the battery of electronic products. or external chargers, for example, smartphone or battery chargers. When using electronic products or external chargers, you should avoid prolonged charging and leave any operating chargers unattended. The best way is to unplug the chargers after use. If you find the chargers too hot, you should switch it off and unplug it immediately. When charging an external charger, do not use it at the same time to charge other devices to avoid overloading it. Protect it from damage, since loose or displaced parts may cause a short circuit or fire. What will you do if you find that an appliance is damaged or given off abnormal noise, smell, or vibration during operation? Are you going to repair it or use it as usual? Please don't do that. You should stop using it and report to your employer. Repairing should be conducted by experienced technicians, but not you. When you clean the electrical appliance, please remember to switch off the power and unplug them. Moreover, you should use the right way to unplug sockets. Otherwise, the wire and the sockets could be damaged easily. Switch off the socket and grip the plug. Never pull the wire and do it with wet hands. You should avoid leaving an operating appliance unattended. Switch off the appliance before leaving home. If you will not use a product for a long period of time, you should switch it off and unplug it. For example, unplug the air conditioner during winter time. Last but not least, it is also useful to know the location of distribution board so that you can turn it off in case of emergency. Now, please watch the last video about the safe use of electrical appliance.
唉，屋企冇人就唔好開住我啦，又唔清下個隔塵網。咁多電器插埋一齊，好易負荷過重㗎。都話咗我唔適合喺浴室用㗎啦。
佢哋應該要揾有經驗嘅技師整下我啦。
仲要睇清楚說明書先好用。
返嚟啦！師傅，幫我檢查啲電器啊！
電器要勤保養，安全用 Action。上機電工程處網頁睇下啦。
點解個手提暖爐走咗出嚟
Okay, that's all for today's presentation. If you want more OSH information about domestic work safety, please visit our website. Thank you.
Hello, everyone. Today, I'm going to talk about ethnic minority mental health experience under COVID-19. And my main target will be the minority population living in Hong Kong and what kind of challenges and experience they are facing during this COVID pandemic and how they are coping up. And we are also discussing about some tips how to take care and cope the stressors which they are facing. So before I go in detail, I would like to mention a little bit about what is health and well-being. We often talk about health, like physical health, mental health, this and that. But today, let's have a brief discussion about it and try to understand as the United Nations Sustainable Development Goal also recognized good health and well-being as their third main goal. So this is very important. And when we talk about health, it includes the physical health, mental health, and social health also. So according to World Health Organization, the definition of health is a state of complete physical, mental, and social well-being, not merely the absence of disease or any kind of infirmity. And when we talk about well-being, it's an active process and continuous process of becoming aware of your choices, which you are making to live a healthy and fulfilling life. And well-being is more than free from illness, or also like making choices is one thing, but also it's a dynamic process where you keep on changing your priorities, your decisions, and then grow. that all include into the well-being. So not the absence of disease, but also taking care of your physical, mental, and social well-being comes under the health. There are many factors which influences the health, because as a human being, we live in a society, we have our some factors which keep on influencing our health status. So when we see health and try to understand what are the factors which influences health of any human being, that comes under individual factors, like what is your age, gender, or genetics, all that comes under the individual factor. Then comes the individual behaviors, like what are the behavior you are doing, or your exercise, your diet, your any kind of addiction, and your coping skill. All that comes under behaviors. Then we live in a society, and then there are some kind of healthcare services and education services, employment, transportation, and there are other kind of services available that also influences health. If there is a good mental health care service or good physical health care service, then the health of that community will improve naturally. Apart from this, there are two more factors which influences health, that is living and working conditions, like in what kind of condition you are working in. If it is not suitable for your well-being or your health, then gradually you will get sick and your health will not improve. So according to the living and working condition, you see you have access to food, housing, and what kind of like you are working alone or you are feeling lonely. Those are the factors. Then working environment, wages and benefit you are getting, and also what kind of air, water, soil, all that quality is there. Then the noise, all this influence our living and working conditions, because if that is not good, then that will impact your health. Then last but not the least, the society where you live, a social, economic, and political factor also affects the health of any individual. Then you can see that different kind of political participation, ideology, then power, inequality, poverty, sexism, racism, those all factors come into the picture when we talk about the health. But we often cannot connect this dot, that how the politics is influencing the health. And you see in around 2019, we had political instability here in Hong Kong, and then that directly influenced the mental health of people living here. Then the COVID came, and again it influences the mental and physical health, access to healthcare services, and many other challenges. So political or the societal changes influences the health of any individual living in that society. Let's see and try to understand briefly about this health triangle. When we talk about health, we talk about this triangle, which include physical, social, mental, or emotional health. So within mental or emotional health, if you see that mental ability or any kind of structural problem with the mental or cognitive ability, that comes in the mental, but they are emotional. That is the biggest part of the mental health that comes when we have any challenge, then what kind of emotions we are facing, that makes our emotional health. Then let's talk more about physical health first. So physical health is a state of physical well-being in which an individual is mechanically fit to perform daily activities and duties without any problem, and it's void of element of the body such as disease, obesity, or immune deficiency. So there are many kind of physical health related sickness are there, which in the absence of that, you make your body physically fit. You do exercise, you have good diet, you do perform your activities or the duties, daily duties well. That all comes under the physical health. Then comes mental or emotional health. That is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. So what kind of thoughts you have, what kind of feelings you have, then what kind of behavior or actions you have, that all shows your mental or emotional health. The third one, very important, because humans are social animals. We live in a society together with a lot of people. So this health is also a very important part of the health triangle. Here, how well you get along with others, because you are not living alienated life. You are living in a society where we all need to be interdependent for fulfilling our need. And one of the need is the health needs. So how well you are getting along with others, your relationship with your family and friends and other community members, and how do you care for yourself and with the others, that all includes under the social health. Now, in our society, we give more and more priority, or we talk more about physical health. When we talk about health, we say, oh, you should do proper exercise, or eat nutritious food, or sleep well. Those all comes under the physical health, to keep yourself physically healthy. And we give a lot of priority during our lifetime to our physical health. But to make our life happy, we need to have healthy body plus healthy mind. So mind is mental health. So mental health is just as important as the physical health. And this is, we as a human need to think that whenever we are talking about health, we need to include in that physical health plus mental health. Not only about eating and doing exercise or running or jogging, but also what kind of emotions and thoughts you are having, and then what kind of coping strategies you are using when challenges come. Those all comes under the mental health. But what happened in our society? We give more priority to our physical health and less to our mental health. For example, once we get sick and we need to tell our boss that today I'm not coming to work, we'll just tell our boss or any responsible person that, oh, I am feeling a stomach ache, or I'm feeling a headache, or I'm having some kind of physical pain, rather than telling that I'm feeling low or depressed or anxiety or having anxiety or any kind of mental health episodes. We try to hide it rather than we try to express what kind of feelings we have. We want to cover it up with our physical health, because there are so many stigma around it, and we prioritize more to our physical health. You can see a child of like 3 year or 4 year knows how to brush the teeth, but if you see a child of 3-4 year has no knowledge if they are crying or anything, even when they grow up, they don't have any knowledge how to do emotional regulation. So that kind of things are there. You can see for the physical health and mental health, there is difference in the people's response. So if you have any, for example, if you hurt your back or have any physical health condition, you will have so many people to take care of you. You will get flowers, bouquets, cards and messages of missing you, or get well soon, or take time, or those kind of things. But when you have any mental health conditions or any episode, then you will find only silence and loneliness. People don't even want to come to see you or visit you in the hospital if you are admitted there, or you are having some those kind of low days, and people don't want to visit because there is some kind of a stigma and misconceptions around that. Resulting of that, or maybe due to other factors, 1 in 4 people has mental illness in their lifetime worldwide, and 1 in 7 in Hong Kong. However, mental and physical emotional health is essential for everyone and at every age. So that is the point which we all need to think, remember, and keep in our mind forever, that mental health is as important as our physical health. In short, I would like to tell you what's a mental health. So mental health is a condition that has a negative effect on the way an individual think, feel, or behaves. So if you have any kind of mental stress or mental health concern or condition or issue or challenge, 3 things will be impacted: your thinking, then your feeling, and your action or the behavior. So it's very important that you make sure that what kind of mental health status you are going to have. Today, I'm going to talk about mental health status of ethnic minority under COVID-19 in Hong Kong. And once we want to talk more about it, I would like to bring your attention to the mental health of migrants who are living here in Hong Kong. And actually, this slide indicates more of the migrants all over the world. Migrants are the people who migrated or moved from their original country to a different country for living. So during this pandemic, their situation became worse. And according to IOM, migrants are particularly vulnerable to the direct and indirect effects of COVID-19. And they were often excluded from the host country welfare systems. In many European countries, in UK, Germany, it happened that people had no access to healthcare system because they did not have that kind of permission to access the healthcare system, and COVID made the things worse. Or they didn't have the visa status, that valid visa status, or there are many other things because pandemics suddenly came and people were in different stages of their immigration or migration stages, and they faced a lot of problems. Then greatly affected by border closures. Borders were closed for a long period of time. Because of that, people get not travel to their home countries. Then there were xenophobic and discriminatory attitudes were there. For Asian, we can see in many Western countries, Asian people had to face a lot of problems. Even in Asia, there are many other people, like all over the world, you can see that this kind of tendency that you bring this virus or that person bring that virus, those kind of attitudes came in the front. Then there are barriers in accessing healthcare services as well as information. That was also a problem. And then because of the unemployment or the job loss, the risk of falling into poverty for migrants increased a lot. Let's see the mental health status of ethnic minorities in Hong Kong. We did not have much statistics about specific mental health of a minority, but whatever we could get from the some recent research, we found that one thing, that there is an urgent need for mental health support for EM community. Second, it has been estimated that approximately 44,000 ethnic minority are suffering from mental health issues. And a survey conducted by MSF and Uplifters and NGO, they showed that 72% of the foreign domestic helpers, they are having depression-related symptoms. So this does not show a comprehensive picture of the statistics of mental health status, but it definitely shows that there is a definite need of the mental health care support. People are suffering. And there are some news articles which I tried to copy paste here and try to see that there are many challenges related to mental health came up after this pandemic, related to their job, related to their education, employment, and their social issues all came up. So if you just want to summarize the stressors for ethnic minority living in Hong Kong, we can find these. I summarized in this bubbles, and the main stressors for ethnic minority for their mental health conditions or the status influencers are poverty, because many were working in a either in aviation sector or restaurant or like hospitality sector, and those jobs were suddenly lost, and because of that they fall into the poverty trap. Then social and prejudice and biases were there, employment conditions, access to information in their language or culturally sensitive material which they could understand in timely manner was missing. Family and relationship, some people people lost their family member or trapped or stuck in their home country or any other country, so that all. And then there were work from home, study from home, those kind of issue in a small house or the apartment, that also created a lot of clashes within the family member. Education was the problem because many ethnic minority families did not afford to have devices for their children to have online classes. Then access to healthcare was always an issue for the when it comes to the mental health care because of a big stigma, language, and there are many other ethnocultural factors as well as system related factors that became source of stress for them. One more segment of people which I would like to mention here, which comes under the minority group also, and they are foreign domestic workers. So we have a big number, around 5% of minority population are made by foreign domestic workers from Philippines, from Indonesia, from Thailand, and different other countries. And what kind of challenges they faced, which impacted their mental health status are, I tried to summarize in these bubbles, are working away from home because they had to leave their family members back home and come here. And the COVID was at both places. When it was, they become more stressed when they heard about the situation back home. And they need to be here alone, not able to go back and help their family. So that created a lot of mental trauma. Then employment condition and wages. That time, a lot of policies came which made helpers not to go out, or there are a lot of discriminatory or the biased approach raised. Then because many employer lost their jobs, so wages was also disturbed, which again came the impacted the frequency of financial remittances they could make. And also the remittance centers were closed for many days. Then paying the employment agency, they had to pay that their debt which they took to come here. That created a lot of mental stress. Not having a private room because everyone in the small apartments, whole employer family was there, and they could not get any free time to relax, to to do any of their activity, and that created a lot of mental stress among them. Then age and duration of stay, that what is their age. And there are a lot of underreported physical abuse case happened during this period, and then discrimination was there. And then work related needs and many other things. But I would like to mention here one thing, that I did a research on foreign domestic workers during this pandemic, and my research showed that foreign domestic workers were very unhappy with the government policies for them, that staying at home, or there are many other policies came up even for the quarantine process. Earlier, they were supposed to do home quarantine, but there were no space for them to do that, or the money, who is going to pay? Employers were not ready to pay. So there were many challenges came up. Then the border closure, not going back, or there are many challenges which impacted their mental health status. Here, I would like to say that once a person is having any kind of stress, which are unavoidable, we will all have some kind of mental health, mental stress in our life. So once we have certain kind of thought, that thought generates tension or sensation in our body. That is like one incident happened, we add that incidence with certain kind of feeling. Once the thought is added by a feeling, that creates an emotion, and then that is what our body starts to feel. So once we have those kind of stressors, where there are discrimination, there are lack of job, lack of money, lack of family members, there are many other negative things happening, that time the mental health is greatly impacted. And if you want to see that the changes in the emotions, that was like more towards the negative side. So what happened in general, if you talk about the mental health conditions, it all starts with stress, and the stresses were around. Even still, we are in kind of lockdown mode, and where you can see that stresses are coming from all sides at all levels. So once there are stresses, then what happened, our thoughts will change. And once our thoughts will change, the emotions will change accordingly. So here you can see the emotion guidance scale. I put this slide just to see that once we have good thoughts or positive thoughts, then our emotions will be like contentment, hopeful, optimism, or positive expectation or belief, enthusiasm, passion, joy, those kind of things. See, the energy is going up. And once we have emotions like fear, grief, insecurity, jealousy, revenge, worry, blame, doubt, disappointment, boredom, those kind of, or pessimism, our energy is going down. So emotion is nothing but energy in motion. So as Mr. Robert Kiyosaki said, that emotions are what makes us human, make us real. The word emotion stands for energy in motion. So be truthful about your emotion and use your mind and emotions in your favor, not against yourself. So let's see this slide about how negative emotions impact our health, not only our mental health, but also our physical health. So if you are feeling hate, cruelty, impatience, that will directly impact your heart and small intestine. Likewise, anger, frustration, jealousy, envy, liver. It will damage your liver. Or worry, anxiety, mistrust, your spleen, stomach, and pancreas. As well as if you are in continuous fear, you will have kidney problem, ear problem, or bladder problem. Or sadness and depression damages your lung, skin, large intestine. So all your important body parts are going to get impacted because of negative emotions. Now let's discuss a little bit how to deal with negative emotions. So we can do in 2 steps. First, let me first briefly describe this, that whatever thoughts we have, accordingly we start feeling those kind of feelings and then behaving. So this is a cycle. You cannot have like thoughts without feelings or feeling without behavior. Whatever you are thinking, you start feeling, and accordingly you start behaving. So to break this cycle or to change our mood, there are 2 ways. First, thought stopping. To stop any thought, whatever unwanted thoughts you are having, to stop that, you need to continuously bring your attention to some word. For example, stop, stop, stop. Or you, if you follow any religion or anything, you can chant a mantra, chant any word, whatever soothes you. And then step 2 is whatever thought you are having, replace it with some positive thought if it is a negative one. For example, here, I would just like to briefly mention that one situation is feeling sad because you didn't get invited to a classmates or friends party. You don't feel like doing anything, okay? So one possible action and thought is you stay home alone and think, I'm really disappointed. Why wasn't I invited? Maybe it's because my classmates or friends don't like me. And you continue, keep on thinking like that. And then your future, you will keep on thinking like sad, even after several hours, and then you will feel yourself less and devalued or whatever, all the negative things. Another possible action is you can change. You can go outside, do some, meet your friend or do something else, something fun. And then that you stop worrying so much about the party, you have something else to do. You feel much happier even after many hours. So thought is, situation is same, and now the thoughts that is in your control, you can change, and then accordingly your emotions and then behavior, everything will change. This is one important slide which mentions more about automatic negative thoughts. As a human, we all have this tendency to think negatively automatically. We attract so much towards negative thought. Whatever negative thing happening in our life, we go there. And for example, if we have a broken tooth, then continuous our tongue will go there, not touching any other 31 tooth, but that broken one. So same thing, if anything wrong happen in our life, we tend to think, our mind tend to think only about that negative feeling. So for that, and it is very, overthinking is a very big problem and one of the precursor for the stress. So for taking care of that, you need to identify those automatic negative thoughts, whatever you are having. Then You need to analyze it. Is this thought helpful in any way? Is there another way of looking at the situation? What evidence is there that whatever I'm thinking is true? Like my friend did not invite me because they don't like me. If I challenge this thing, maybe there could be 100 of many other reasons, but if I think only this one, then that will lead me towards the negativity. Then how would someone else see this? Same situation happened to your friend. Would you tell that because your friend don't like you, that's why they did not invite? Or you will tell something else? So those something else you need to tell to yourself. And then what additional, would I give to, or what kind of advice or any kind of other views you can give to, if it is the situation, to someone else? And then whatever you are thinking, is this fact or opinion? It's just the mere opinion that you are thinking, or it's a fact about that? Once you can analyze your thought, that will help you to come up with more realistic and optimistic thoughts. You will stop those negative, the spiral of negativity or the negative emotion, or because of negative thoughts or the overthinking. Because what happened, that it's a trap. Overthinking is a spiral trap. You think one thing negative, and then that will lead to another one, and hundreds of the negative thought will take you to lower your energy. Mindfulness is another one very easy technique which all of us can use to bring positivity back in our life. Most of us live in our psychological world. We live in our mind. We don't see our real world. Things happen, things around us, we don't notice because we live in our mind. We eat and watching TV or watching video or anything, or thinking something. So that kind of thing is very dangerous, and mindfulness gives us chance to bring us back to this real existing world, not only the psychological world. And we can do this mindfulness starting from our 5 senses. Sight, like you see, what are you seeing? What are you hearing, smelling, taste, touch? Just start with one thing, that when I will eat, I will not watch anything. This is one step towards mindfulness. And by doing that, you are strengthening your brain, your mind, to be present in the present moment. And that helps you to reduce the negativity or the anxiety. Because as a human, our tendency is either to be in the past and feeling depressed, thinking about or ruminating about the past, whatever negative happened, or we go in the future and feel anxiety or the fear, what will happen in the future. So not living in the present moment, but living in the past or the future, that creates a lot of anxiety, stress, and also like depression. So this is one simple technique, the grounding techniques, where you are using your 5 senses, starting with just watching or something, to bring yourself back to the normal or the calm state. There is one acronym ROARS for the self-care of your negative emotions. And that is, first, don't ignore your emotion. Recognize and label your emotion. I'm feeling angry, I'm feeling sad, I'm feeling depressed, I'm feeling disgusted, I'm feeling whatever, you name it. Jealous, envy, you name whatever feeling you have. Then observe your feeling. Whatever you are feeling, you observe that. You don't indulge in that feeling. You come out of that and see that feeling as an observer. When you try to see that thing, just think that your friend is behaving or having that feeling, and then how you are looking at your friend. Then accept and validate. Once your friend is getting angry, it does not mean that you will also get angry. So you just see and accept, yeah, maybe this friend is having some bad day or anything. Then you try to understand. Similarly, behave with yourself. And then release it by start thinking differently. Okay, I got angry of this situation. Can I change my thought? Can I not get angry? Can I accept it? Those kind of things. Because there are many challenges happen back home or happen in the workplace or anywhere. And if you are keep thinking on the that this happened, that happened, and not coming to the present moment, chances are high that your occupational safety will get impacted. Whatever you are doing at your workplace will not have any productivity, and you can be at a great danger. To start this roads with emotion for self-care, there are step-wise solution. One change at a time. Always remember. For example, you start sharing your emotion with some trusted friend or family member, not piling up or letting it rotten within you. Let it come out. You share it. Seeking advice or professional help or anything, you go for it. Or physical exercise, walk, jogging, or anything, whatever suits. Then mindfulness, sleep regulation. Sleep is becoming another pandemic in near future. So sleep regulation is very important, that you give 7-8 hours to yourself for sleeping. Maintain sleep hygiene and the hours. Pursuing hobbies, or the time you are spending on social media, you can cut it, or any screen time you can cut and give that time for your hobbies. Then conscious relaxation or rest. You go out in the nature or do any kind of activity which consciously relax you. Here, our role is not only to do self-care, but also to care for others or support others. For that, I would just like to briefly mention two things. First thing, be non-judgmental. When anyone telling you about your problem, about their problem, then you need to be non-judgmental. And what does that mean? There are some, I like this one. There are some more words which we can use, like open-minded, unbiased, unprejudiced, or accepting. So a non-judgmental is the acceptance of the people the way they are, not the way you want them to be, is the foundation of non-judgment. So you need to be non-judgmental. Just be neutral and listen to them, what the other people are saying. And that is the biggest help you can do, or the support you can do to your community member, to your friend or family member. The second thing is active listening. That is a very big skill. So once what happened that we want to talk to our friend and our friend is busy in chatting or doing mobile, or like watching in the mobile or doing any other thing, that is not active listening. For active listening, you need to remove all kind of distractions, do eye contact, sit, relax, and then your body gesture should be very welcoming and comforting for the other people to tell you their problem. Give feedback and show that you are listening. All these will help other person to share their emotions or whatever they want to share. Because in the community, when we talk about mental health, we just think about the hospital or insanity or different things. But it all starts with you and me sharing. If our emotions can be shared and regulated well, chances are high that people will not go into the stressful mode. And once there is once this can be reduced, the stressful period or stressful situation or events can be reduced, then their chances are high people will not go into the depression or anxiety mode. And that is the precursor of many mental health conditions or the diseases. So it's better that we start communicating. Once there will be a better communication, then there will be lesser stressful period or stress. There are some more tips for building positive perception for domestic helpers in Hong Kong, and that is, look, emotional feeling is a signal that tell you something. It is just a summarized slide which I wanted to share with all of you, that whatever you are feeling, it is giving you a signal. It is not for vain. It is not wastage. It is telling you something. You need to listen what is telling. Then accept it's okay that you are not okay at this moment. When you will have that kind of acceptance of any unusual thing, then it will be easier for you to go through that phase. Then understand what you need. Sometimes we don't need and we are feeling frustrated. So try to pinpoint what are your needs, what can make you feel better, or what can make the problem solved. Then recognize where is the gap, what can be done, what cannot be done, or what is the feasibility, or you see what is your values, what you want to do. Then there are two tests, which anxiety assessment tool and depression assessment tool, which are GAD-7, generalized anxiety disorder 7, which is just like a thermometer. You measure your temperature So these are the thermometer for mental health, for depression and anxiety. But this does not mean that you are doing diagnosis. No, for just thermometer does not make you feel better, right? You can only know that you are having fever. Same way, this depression and anxiety can tell you that you are not having the normal range of mental health status. You're having some kind of depression or anxiety or fear. So you can go further for any professional help or share with your friends who can take you to some professional help. There are some available resources in ethnic minority languages. You can call, you can talk to them and ask for help, ask for services availability or anything, or any information you want. And here I would like to end up my presentation. Thank you very much.